so happy today to have on our show again Dr. Patrice Walker, who's the Chief Medical Officer for Atrium Navicent Health. And we're not trying to beat you to death with this as it relates to COVID and all of the ramifications and surrounding information as it relates to COVID, but it's understand. Now, let me tell you why I say this, because the entire country has been bombarded with misinformation. So as a part of our mission, both as it relates to a call to action and as it relates to Atrium Navicent, we just want to make sure that the information that's out there is documentable, evidentiary, and reliable. So that's why we have Dr. Walker on the show, because she knows, she's trained, she's qualified, she's experienced. And then, I'm so sick and tired of being sick and tired of having to wear a mask and, being worried about this COVID thing till I don't know what to do. But we can get through it and we can get over it and we can accomplish herd immunity or close to it, if in fact we pay attention to not misinformation, but real information. And before I introduce Dr. Walker, I got one more thing to say. That's my story, and I'm sticking to it. So how you doing, Dr. Walker?
I'm doing fine, Mr. Haversham. Thank you so much for having me on again.
Yes, ma'am. Thank you for coming. So what we want to do, we want to talk about a lot. And then what I want to encourage the community to do early on is that this show is on YouTube and we blast it out. And it's going to be on Bounce TV twice on Sunday mornings. And we put it on Magic 100. But if you want access to it, then you can go to Alex Habersham YouTube, and then you can see not only this show, but several shows. But I'm sure that many of you want to send this to all of those, Doc, let me say this. It absolutely befuddles me, how real intelligent people, now I don't have a problem with believing what you want to believe, but I do think that whatever we believe ought to be based on objective and documentable information. So that's why I'm letting the people know how they can find this information. And you could Google Dr. Patrice Walker and you will see that she's eminently qualified to address what we're going to address today. So let's start. Let's get started.
All right.
Let's talk about, first of all, let's talk about one thing I'm interested in, I'm sure other people are. Let's talk about the COVID shot and the flu shot. What's their relationship and how should one act or interact? Those of us who are going to take the flu shot. So let's talk about the caveats and the information, the dangers, the correct process of tying in, if you please.
Absolutely.
Flu shot with the COVID shot.
Well, first and foremost, everybody should get both shots, period, point blank. If you are over the age of 12, you should be getting both shots. You should be getting COVID-19 and flu vaccine. Of course, under the age of 12, can't get the COVID vaccine, but they can get a flu shot. So the simplest way to answer that question is everybody should be, if you're eligible, you should be getting both. Now, in terms of the timing, at this point, there's really no reason to wait. You can get the flu shot and your COVID vaccine shot on the same day.
Wow.
Or you can get them, within any time period. If you got your COVID shot last week, you can get your flu shot this week. The only thing that really needs to be delayed or that would affect the whether or not you get those shots is if you have had an infusion of that monoclonal antibody infusion. And I know we're going to talk about that in a few minutes, but if you are somebody that has had that monoclonal antibody infusion, then you do need to wait 90 days because that monoclonal antibody infusion might block the vaccine. It might block the immune response that we want you to have due to the vaccine, the flu or the COVID-19 vaccine. Otherwise, everybody should get it. And in fact, if you don't usually get the flu vaccine, this should be a reason for you to start getting it. Because what we want to do is we don't want to have multiple, illnesses out there with similar symptoms and presentations. And generally speaking, at least in the beginning, the flu and COVID-19 present very similarly, fever and chills and aches and you feel sick. And so we want to make sure that if you've had your flu shot, then okay, well, at least we can say this is probably not the flu. But if not, then it could be the flu. And we've already had patients with both the flu and COVID-19 at the same time. So that is a thing that you can get both.
Now I know you all see why I want you to share this with your friends, relatives, and colleagues, because this is good, real information and not misinformation. Okay, Doc. Now, how does that information that you just gave us tie in with the booster shot? Say for example, I've got the COVID shot. I'm double vaccinated, and then I'm waiting on 2 more. I mean, science permitting, my booster shot and my flu shot. So how do they tie in? Does what you just said apply to the booster shot and the flu shot, or is there a difference?
So with the booster shot, first and foremost, what has currently been approved by the FDA, by the CDC, is a 3rd dose for people that are immunocompromised. If you are taking chemotherapy, if you have HIV or any condition that would cause your immune system to not function at its optimal level, then as of right now, you can go to any pharmacy that has the COVID vaccine and you can get that 3rd dose. What is still in process as of today, as we're taping today, is whether or not everybody needs a booster shot. And as of right now, the FDA says that if you are over the age of 65 or at risk for severe disease based off of other medical problems that you might have, or if you work in a job that puts you at high risk, like a healthcare worker, teacher, you work in childcare, grocery store, all of those things, then the FDA has granted emergency use authorization for those groups of people. However, the CDC has not yet approved that. And in order for it to get to be a full recommendation, the FDA has to approve it and the CDC has to approve it. So maybe by the time this airs, we'll have a final decision, but right now it's still in the works.
Okay. Now, correct me if I'm wrong. Now, right now, that as it relates to the booster and the approval from FDA and CDC, that applies to Pfizer?
Yes, that only applies to Pfizer, and it's 6 months. It's actually 6 months after your completed 2nd dose. So, we've been hearing lots of different time frames. 8 months was thrown around out there for a while, but what has been approved by the FDA thus far is 6 months after that 2nd dose of Pfizer. So right now, if you received Moderna, then there's no recommendation for you yet. Now, Moderna's going through the same process that Pfizer has gone through, but theirs is not as far down the road. So right now, if you received Pfizer, then this this potentially could apply to you. So you've got to know what you received. You got to know whether it was Pfizer or Moderna. And if you receive Moderna, then you're going to have to wait. Right now, they are not approving you to swap. You know, they're not saying if you got Moderna, then it's okay for you to get your booster as Pfizer. That is not approved. You got to stick with what you started with.
Well, how did you know that was my next question? That absolutely was going to be my next problem. Well, let's talk about actual COVID-19 occurrences, okay? And then what I want to discuss is, first of all, let's just, and I got monoclonal antibodies. Let's talk, did I pronounce it correctly?
You did, very good, yes.
Thank you very much. Let's talk about the monoclonal antibody. Mm-hmm. And then, you know, what breaks my heart is I see too many instances of people who believed in nothing. No monoclonal antibodies once they had it. They wouldn't take the shot, telling me I already had COVID one time. Address that right quickly. Just because you had it one time, does that necessarily mean that you are now immune?
Not necessarily. It certainly can give you some protection, but we have had people that have had COVID more than once. So you should not feel, you know, significantly safe just because you have had it one time. The vaccine is still recommended even if you've already had COVID.
Okay. Well, I just wanted to get that clear. Mm-hmm. Okay, so talk about the monoclonal antibody. I mean, and what are the circumstances under which people should take it and blah, blah, blah.
Sure. So monoclonal antibodies is a tool in our toolkit against COVID. However, it is not a replacement for the vaccine. The vaccine should be your number one tool in the toolkit. Monoclonal antibodies are supplemental, you know, to that. So they can be given in two different ways. It can be an IV infusion, or it can be an injection given under the skin. Either way is acceptable. And this is done on an outpatient basis. You don't get this in the hospital. This is somebody that's not sick enough to be admitted to the hospital, but has either been exposed or tested positive for COVID-19 within the last 10 days. There's a 10-day time frame because it works best early on. So if you've been sick for more than 10 days, or if you got exposed more than 10 days ago, you're not going to be eligible for it. And basically, monoclonal antibodies are a substance that blocks the virus's ability to attach and get into the cell in the human body. If that virus cannot attach and get into the cell, it cannot duplicate itself. So the monoclonal antibody, it acts while your body is building up its own response. It buys you some more time. That's why it's important to get it in the system as early as possible. But again, the best thing is for you to be vaccinated, because if that has happened, then your body can ramp up that protection much faster than if you've never been exposed to anything before. There are other criteria for the monoclonal antibody. I won't go through all of them, but suffice it to say, if you've been exposed or if you test positive, you should call your physician and say, hey, I've heard about this monoclonal antibody. Am I a candidate? And if so, can you order it for me? There are various places around town that you can receive it. Of course, at Navicent, we have a site. There's a site in Houston, at our Peach facility, and at our Baldwin facility. We have infusion sites there. So, and Monroe County as well has infusions there. Now, I will say the government has really, they have clamped down on the amount of infusion out there because so many people have been, using it in a good way, but it's a limited resource, just like masks and everything else. So it's now on allocation. So hospitals and clinics that are giving it only get a certain amount. So since that certain amount is out there, what we're beginning to see is they're getting a little bit more strict on who can get it. We really want the people at highest risk for severe disease to have access to it.
So, but now if you test positive, then the rule is, or the scenario is, that you can take the monoclonal antibody, but you don't take the COVID shot, immediately while you're positive. Is that correct?
No, not necessarily. The CDC now says that you really don't have to wait. So in the beginning, we thought that you needed to wait some amount of time before getting vaccinated, but you really don't. I mean, in a perfect world, you would want to wait until your symptoms are, resolved. So your immediate symptoms. I mean, you're probably not going to feel good enough to be up going anywhere anyway. So you want to wait until you're not having a fever and generally, feeling better. But in terms of needing to wait 30 days or 60 days or 90 days, you do not have to wait to get that vaccine. So as soon as your acute symptoms are resolved with COVID, you can immediately go and get that COVID vaccine. Now, remember, the exception is if you get that monoclonal antibody infusion, though, you do have to wait 90 days. Otherwise, those antibodies will actually fight off the vaccine. So we don't want that.
So you don't want to get them. You don't want to get them both like simultaneously. So if you got the monoclonal antibody, then you need to wait 90 days before getting the COVID. But
Right.
if you had COVID, and the major symptoms are gone, then it's okay. Rather than waiting 90 days, you can go ahead and get the COVID shot.
Absolutely. Yes.
Yeah. Okay, well, talk a little bit, although you've done it once, talk a little bit about all of these theories and misinformation. You've done a show on it once. All the misinformation that's out there. I had a person to tell me, that it was going to be radar. They putting radar up your nose, and well, what all of the, and something down. It breaks my heart, literally. And I've had several friends and good friends that die. And before we come off the show, I want you to talk a little bit statistically, even if you do it without specific numbers, to kind of explain the ratios of people in your hospital and other hospitals who have been vaccinated and they're in the hospital, have not been vaccinated and they're in the hospital, have been vaccinated and living, have not been vaccinated and dying. Just talk about that relationship and the proportionality, if you please.
Absolutely.
What's happening with that, in addition to, if you can kind of tie that in with all the misinformation.
Yes. I hear a lot commonly today, people say, well, why should I get vaccinated? I'm hearing that people that are vaccinated are getting COVID. So why get vaccinated? And I want to say that it is true that you can still get COVID-19 even though you've been vaccinated. However, those are not the people in the hospital. Those are not the people in the ICU. Those are not the people on the ventilator, okay? The people that are vaccinated that still get COVID are those that have a mild, course. Sometimes they don't even know that they have it. And if they do have it, it's a very mild course. They don't need to be hospitalized. And in general, that is what we have seen here at Navicent. Our numbers are going down, thank goodness. But, during the peak, when we had, 180 people in the hospital in our whole system, 98, 99% of those people were unvaccinated.
Wow.
And of those people that were in the ICU, again, almost all of them, 99.5% of them were unvaccinated. And on the ventilator, again, the same thing. So there may have been one or two people that needed to be admitted, but the vast majority of them are unvaccinated. And if we look at the entire state of Georgia, looking at the millions of people that are vaccinated versus those that are unvaccinated, those same numbers hold true. It's about 1% of people that are vaccinated that get that breakthrough infection. And of the not vaccinated, it's 12%. And that number is really only the people that go and get tested, okay? In both cases, that 1% and the 12% are only those people that go and get an official test. So just keep that in mind. But of those 1%, it's like 0.03% that are in the ICU, and then it's 0.009%
Wow.
that die. So it's not zero, but it's as close to zero as you can get without being zero.
Yeah.
And the way that I like to think about it, just to put it in perspective, is it's really like wearing your seatbelt, right? We all are supposed to be wearing our seatbelt. The seatbelt itself does not prevent you from getting into a car accident. You can have your seatbelt on and be driving good, and you can still get into a car accident. But chances are, if you have that seatbelt on, you're going to walk away from that accident. If you don't have that seatbelt on, you're going to have a much more severe injury. And even if you have a severe injury with the seatbelt on, we don't then go out and say, well, we just ain't going to wear our seatbelt anymore, you know?
Right.
So I really think people should think about it that way. Think about it like that seatbelt. That vaccine is your seatbelt. Might not prevent you from getting it, but if you do, you're going to walk away.
Right. Well, that is so extremely important. So the statistics has shown that it just makes sense. It makes intellectual sense. It makes human sense. It makes relationship sense for us all to get vaccinated. Well, talk a little bit about the numbers. I'm happy to hear you say and what you think that's attributable to, that they seem to be going down. And then you talk a little bit about the scenarios. Oh, let me ask you a question right quick. If I'm in a meeting and I got to make a speech, and then, you know, everybody's wearing a mask, and I want to take my mask off for, say, 3 or 4 minutes. I mean, is there a time frame that it takes? Because I know it's airborne, that it takes for that COVID to kind of reach me. I mean,
well, yeah, yes and no. There's a time limit and there's a distance, right? So what we say is that the time limit is about 15 minutes and the distance is about 6 feet, give or take. So 6 feet, 15 minutes without masking is sort of the, you know, those are the numbers that we've been using. Is that exact? Probably not, but that's an estimate. So, and just remember, the thing about mask wearing is really the mask that you wear does not protect you. The mask that you wear protects everybody else from you. Everybody else's mask that they're wearing protects you from them. So that's hard to think about in your head, because when you think about it, you think I'm going to put my mask on to protect myself. But that's not how it works, because in order to protect yourself, you got to have like an airtight seal. And most of the masks that we wear are, you know, on the outside are these, you know, they're not airtight. Air can get in. But what it is it's preventing you from, you know, spreading any germs that you might have out to everybody else around you. So the best thing is for everybody to have a mask on. That way you're protecting them and they're protecting you.
So if you're in the company of somebody who does not have a mask, because you have a mask on, does not mean that you are protected. You
Not
even
necessarily, not
yeah,
necessarily. Now that
yeah.
still don't mean you should take it off.
No. I'm just saying.
But
I'm just saying that you probably better on with it all. But my point is that because you've got it on, then you need to be careful about the company you keep,
yes,
and about the behavior of the company you keep,
yeah,
because even with that mask, they can still have COVID and give you COVID.
right. The vaccine is your best protection, not the mask. You
Yeah.
still need to wear the mask. You still need to wash your hands, stay apart, but it's the vaccine that is protecting you.
So it seems to me that you are still highly encouraging everybody to take that vaccine.
Absolutely. Yes.
Yeah. Well, that is so very, very important. And then I want to, if I may, Dr. Walker, and I want to introduce her again. This is Dr. Patrice Walker, who's the Chief Medical Officer for Atrium Navicent, and she's been on the show several times. But we need your assistance, if you please. Those of you who are within the earshot and the eyeshot of this show, go ahead and impart this information. And those of you who believe in the vaccine, and even those of you who do not believe in it, Andrea, I didn't see how much time you said, and Dr. Walker and I are on a roll. Yeah, I see you now on the road. But we want you to assist us and assist the community. People complain about not being able to go to parties and not being able to go in the country. And although some people are going, but there are still risks. But if you could, just get the 85% of the people vaccinated, then, you might be sitting next to somebody. Well, if they're vaccinated, you just about to hold hands. But then if they're not, then you've got a danger. So I'm most appreciative to Dr. Walker for her knowledge and her willingness to, to kind of impart this information. Is there a general source, where people can kind of garner this kind of information? Can they go to a website or anything of that nature?
Absolutely. The CDC website is the best website, and that is www.cdc.gov. And they have it in a easy to understand. So it's not, I don't want people to think, oh, that's, I'm not gonna be able to understand any of that. They have it on there where everybody can understand it. If you want more detail, you can get more detail on there too, but they have it broken down into very simple, easy to read things by, and you can search if you want to read about the vaccine or the monoclonal antibody or boosters. So that should be your resource, your first resource. The FDA is also a good resource, but I would say the CDC is right here in the state of Georgia, right here in Atlanta. That's a great local resource, but no matter where you are, you have access to that.
Thank you so much, Dr. Walker. This is a call to action. I'm your host, Alex Habersham. We are on podcasts. We're on Bounce TV. We're on Alex Habersham YouTube. We are on www.makeemcalltoaction.com. Please assist us in recommending this show and getting it out so we can all go to the club and to the baseball game and to the football game, not worried about the COVID-19. This is a call to action. I'm your host, Alex Habersham. Having interviewed Dr. Patrice Walker, Chief Medical Officer of Atrium Navicent Health. Have a great day.